All right, I'm doing my complete inpatient reassessment today, and so my patient is in there. Before I would go in, I would check the EMR to make sure there's no new orders or lab values or anything that I needed to look at, and I would also look at the door to see if there was any markers or flags or anything before I go in, but there are none, so I'm gonna go on in.
Hi.
I'm Emily, and I'll be your nurse today.
Okay, sounds good.
Can I see your wristband?
Sure.
Can you tell me your name and your date of birth, please?
Christina Yates, 09/12/1995.
Perfect, thank you. What brings you in today, Christina?
Just have a really bad headache.
Okay.
Yeah.
Can you rate your pain on a scale of 1 to 10 for me?
Sure. I'd probably say it's like a 4 or 5.
Okay.
Yeah.
And can you describe your pain for me? Is it like throbbing, dull?
It's kind of throbbing. Yeah.
Okay.
It's like right here.
Okay. And what makes your pain better or worse? Have you found anything?
So, I mean, loud noises seem to like really bother it. Other than that, it's just kind of been steady. I've taken some ibuprofen and that's helped a little bit.
Okay. And does it radiate? Does the pain radiate anywhere else in your body?
No, just kind of stays right there.
Okay.
Yeah,
Okay.
I think so.
And when did this start?
About 2 days ago.
Okay.
Yeah, I woke up with it.
Okay.
Mm-hmm.
All right. And so just after watching Christina for a little bit, I can tell that her facial expression is comfortable, it's calm, it's appropriate to the setting, as well as her posture and body position. She has good body alignment. She is conscious and alert. And Christina, can you tell me your name, please?
Christina.
Okay.
Christina Yates. There you go.
And can you tell me where you are right now?
I am in the hospital.
Okay, and about what time is it?
It's about 5:30 now, I think.
Okay,
Mm-hmm.
and so she is alert and she is oriented ×3, so that is good. I can tell her skin color looks pink, not too red or blue or pale or anything like that. Her speech is articulated, and it is appropriate to the setting. I can tell she hears me and understands me because she is speaking back to me, and I know that her hygiene seems to be good. There's no odors or anything like that. So next I'm going to move on to your vital signs.
Okay.
First I'm going to take your temperature. Okay. So, yep, I'm just going to stick it to your ear. Okay, 97.9, so not too bad. And then I'm going to take your pulse oximetry. Sometimes it's a little touchy. So it's not working today, but typically it would work, and it would just show her oxygen concentration in her blood. I'm going to listen to your apical pulse and take your pulse that way.
Okay.
So if you could just put your gown down a little bit, just so I can get to that. Thank you. Okay. I'm just going to
Go for it.
Okay, you can put your gown back up. So your pulse was about 67 beats per minute, and then your respirations were 12. So those are all in the normal limits, so that's good.
Great, thank you.
Okay, now I'm going to take your blood pressure.
Okay.
So first I'm going to estimate it. I'll have you turn.
Okay.
Thank you. I'll just roll that up. All right. Is that too tight?
No, that's
No.
great. Yeah.
Okay. So, I'm going to start by finding your estimated systolic pressure and then go from there.
Okay.
Okay, so is that about 120? So that's good, and so I'm just going to blow it up next time to about 140.
Okay.
Gonna make sure. Okay. Sorry about that.
Oh, no worries. Those things are touchy.
Okay, so you were right at about 120 over 76.
Okay.
So that is very good.
Great.
All right, you can turn back around. All right, next I'm gonna do just a slight neuro check.
Okay.
And so first I'll use the Glasgow Coma Scale to note her eye opening, her motor responses, and her verbal responses. And so I've been able to tell that her eye opening is spontaneous, her motor responses have been purposeful, and her verbal responses have been appropriate to the situation. So that's all good. I'm going to use my pen light now, and I'm just going to measure your pupil size, just like that. Looks about 3 millimeters. Now, if I could have you look straight forward, I'm just going to shine this and check your pupils, okay? Good. And so both her left and her right pupils were directly and consensually reactive to light. So good. If I could have you squeeze my hands for me. Good. Now I'm gonna have you pull, push. Good. Thank you. And then can you lift your legs up? Perfect. Now I'm gonna just have you lift up your feet. Good job. And push down. Very good. So all of her movements were strong. I rate them a 5+. And when I'm looking at her face, I don't notice any ptosis, facial drooping. If you can take a sip of this, I'll check your ability to swallow. You have no problems with that, right? No. Okay. Now, I'll have you close your eyes, and I'm just going to see if you can feel different sensations in your body, okay?
Okay.
So just tell me when or if you can feel them, okay?
Okay.
So, can you feel that?
Yeah, right here. Right here. Right here. Right.
Very good. You can open your eyes.
Okay.
Have you been experiencing any numbness or tingling or anything like
No,
that?
not at all, actually.
Okay.
That's good.
Perfect. All right. Now I'm going to move on to your respiratory system.
Okay.
And so as I've been watching her, I can tell that her respiratory rate and pattern is unlabored. She doesn't look like she's having a hard time breathing at all. If she had an O2 mask or anything like that, I would check that just to make sure it's running properly and everything like that. So I'm going to have you bring your gown down again so I can listen to your lung sounds. Thank you.
Okay.
So just when you feel my stethoscope, just take a deep breath in with your mouth.
Great.
Okay.
Yeah.
Okay. And if you will turn for me, I'm going to listen to your back. Okay. And just like that. Thank
Yep.
you. Okay, you can put your gown back up and just turn around. All of your lung sounds sounded clear. There was no adventitious sounds that I could hear.
Good.
If there were, especially, I would educate you about deep breathing, using your incentive spirometer, things like that. Have you had a cough recently?
No, actually, not at all.
Okay. If she had had a cough, I would just educate her and ask her about the mucus that she was producing, the color, the amount, and the consistency of that. Okay, and now I'm going to assess your cardiovascular system. So I'm going to ask you to bring your gown down again.
Okay.
I'm going to listen to all the oscillatory parts of your heart. Okay, I'm just going to pull this down a little bit.
Go for it.
Okay, I'm going to go this way. Thank you.
Yep.
Okay, now I'm going to use my bell in the same spots. Okay. Okay, you can put your gown back on. So, your heart was sounding great.
Oh, good.
The regular or the heart rate, the rhythm at your apex was very regular. I didn't hear any murmurs, extra sounds, or anything like that. I heard S1 best at the apex and S2 best at the base. So that is very good. If you could show me your hand, I'm going to check your capillary refill. Good. 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 Her capillary refill time is good. It's less than 3 seconds, so that's healthy. Now, if you could just scoot back a little bit, I'm going to pull this out. Thank you. And now I'm just going to roll your pant legs up and check for edema. And my hands are a little cold.
It's okay, I haven't shaved in a while, so.
So, and there's no edema on her tibia, ankles, or her feet. All right. And I'm going to take your pulses now.
Okay.
So I'll take your radial. Okay. This side. Okay, and both of those pulses were plenty strong. They weren't bounding or thready or anything. I would rate them a 2+. And now I'm going to find your posterior tibial pulse. And I actually found that right away. That feels like a 2+. And your right side does as well. Okay, and then for your pedal pulses. That one's not quite as strong, but I would still rate it a 2+. Yep, I would rate that a 2+ as well.
Okay.
So I'm gonna scoot forward again. At this point, I would check her IV if she had one, the flow rate, and make sure everything was working properly with that. Throughout the assessment, I've been looking at her skin. She has no apparent lesions, any problems with her skin integrity. I don't see noticeable bruises. She doesn't have a wound or dressings or anything like that to worry about. I would look at the skin temperature on both sides. I'm just going to feel, okay. And she feels warm, but not overly warm or cold or anything like that. I'm going to test your skin turgor. And your skin turgor is very good. At this point, I would use a Braden scale or any standardized assessment scale to assess her risk for skin breakdown. And that would include things like sensory deficits, which are not apparent right now. Her mobility and activity, and she seems to be fine. She can get up and move around as far as I can tell. Any excess moisture, which is not apparent. Her nutritional status, which seems fine as far as I know. And then friction and shear, she's not in bed rest, she's not laying in a bed. So I don't think we have to be worried about her skin integrity as of right now. At this point, I would also check into any specialized devices like an airbed or anything that would help to prevent any skin problems or anything, but she doesn't have that, so I can't look into that. Okay, now I'm going to assess your abdomen, so if you can lay down for me, Alright, and then I'm just going to have you pull your gown up so I can look at your abdomen. Okay, and just looking at the contour of her abdomen, I can tell that it's flat. I'm going to auscultate your bowel sounds. Make sure this is warm.
Thanks.
Okay. And I did hear bowel sounds in all 4 quadrants. I'm trying to warm my hands up a little bit. I'm going to palpate your abdomen. Just push on it and tell me, you can let me know if you feel any tenderness or anything, okay?
Sure.
So. Any tenderness?
No.
Okay, and I can know that she has no tenderness, no distension, no firmness in her abdomen, so that's all good. You can bring your gown down again and sit up. I just have a couple questions.
Sure.
Have you been passing flatus or stool?
Yeah, I go to the bathroom, like have a bowel movement every day, usually in the morning. Yeah.
Perfect. When you go, can you tell me about like the color of your stool?
It's pretty like medium light brown.
Okay.
Yeah.
And what about the consistency? Is it hard, soft, in between?
Soft.
Okay,
Yeah.
good.
Probably.
Okay,
Not
perfect.
like diarrhea.
Yeah.
Yeah.
Have you had any nausea or anything?
Mm-mm.
Okay. So there's probably not any problems with your diet or anything with tolerancing.
No, I usually, yeah. good with my diet.
Okay.
So, yeah, it's pretty strict.
Okay.
Yeah.
And then at this point, I would check any suctioning, any GI, NG tubes and things like that if she had them, just to make sure they were working right and everything like that. I'm just gonna ask you, when was the last time you urinated?
Yeah. This it was like an hour ago.
Okay,
I
so
think.
you're urinating pretty often and frequently.
Yeah. Mm-hmm.
Okay. When you do urinate, what's the usual color?
It's usually pretty clear. I drink a lot of
Drink a lot of water.
Yeah.
Okay, maybe a hint of yellow.
Yeah,
Okay.
like for sure. Yeah, definitely a little bit
And
yellow.
so when it's not ever cloudy or anything like that,
No.
is it usually a lot, a little, probably like a?
Usually a little. Just
little.
like a little.
Okay.
Yeah.
Okay. And do you ever have any pain or anything while urinating?
No.
No.
Nothing like
Okay,
that.
good. At this point, I would do a bladder scan if that were indicated, but it's not. Okay, and now I'm going to assess your activity and mobility. I would see if she were on bed rest, I would check the positioning of the head, if she needed a turning schedule, if she had any risk for pressure ulcers or skin breakdown. And then also I would check if she had orders for TED hose, SCDs, foot pumps, make sure those were all plugged in, working properly to help her with her activity, mobility and stuff. Have you had any problem with your mobility? Do you need assistance going to the bathroom or moving around?
Nothing like that.
No.
Yeah.
So you haven't had any problems, just like walking a normal amount or?
No, yeah.
No.
I'm fine with that.
Okay. All right. And I would use a standardized scale just to assess her risk for falls. That would include looking at her medications, her previous falls if she had any, and then her level of consciousness would be important to look at as well. But she doesn't seem to be at risk for falls at all, so that's not a problem. And then that pretty much concludes the assessment. I'm going to make sure bed brakes are on, side rails are up appropriately. If you had a call light, I'd give you a call light. Is there anything else you need?
I don't think so.
Okay, well thank you so much for
No problem.
cooperating.
Thank you. Yeah.
All right, it was nice to meet you.
Thank you. You too.